biggest challenge are two things. First, whatever you make has got to be really reproducible with the associated documentation that show that you can demonstrate that it's reproducible and that documentation is traceable. That's the first thing. That's really towards getting ready for a clinical trial. The second thing is we were confronted with a number of prototypes that we really got into regular dialogue with clinicians to really get their feedback. After all, they are the end user. They are the people that are going to implant the material. And that really featured prominently in looking at we accompanied surgeons in tests on cadavers, really looking and trying to understand how the surgery is carried out, what kind of mechanical stresses the material will be put under during implantation, as well as the more conventional tests that were done like biocompatibility, leachables and extractables to make sure that nothing comes out of the implant that could contaminate the site of implantation. And those are fairly conventional tests. I mean, they're not anything special. They follow according to the procedures of ISO 10993, as well as the requirements according to ISO 13485.